Thank you, Libby. And if you'll just keep letting folks in, I'll try to as we get started, but just in case. Hi, everyone. Welcome. We are glad to have you here today for our National Ombudsman Reporting System, or NORS Q&A. Thank you for joining us. My name is Amity Overall-Labe, and I'm the NORC Director. For those of you that tried to join on September 21st, we really apologize for the capacity issue for that technical assistance talk and appreciate you making time again to join us today for some live Q&A. I want to review some logistics first and the agenda, and then we'll get into the discussion. As you may have already noticed with the pop-up window on your screen, we are recording this call and we will post it shortly after the live presentation. For those of you that may be new to this format, we're using a Zoom meeting platform instead of a Zoom webinar. We do that for these calls so we can make them a little bit more informal and easier for you to ask questions and respond to questions verbally, as well as posting questions or comments in the chat. So our only favor is that we ask you not to unmute yourself until we acknowledge that you've raised your hand. So if you look at the options on the More button, you can raise your hand and we'll call on you and you can unmute. We are also offering certificates of participation for this, as well as other live NORC calls. You must register individually and attend the live session using your registration info, so we have your name and email, and be on the call for at least 30 minutes and you'll receive a certificate, and you can use that within your program, hopefully for continuing education credit. If you have any questions about those certificates, there is a link to our FAQ page for that. At the very end of the webinar, I will post a link to our evaluation. If you would complete that, we'd appreciate it. And just like we do in all of our calls, we will include a link to our slides here shortly in the chat. And there are links throughout the presentation where you can access resources. Next slide. You may have noticed in the registration email that we asked you to watch the recording from the September 21st TA talk before joining the call today. However, we understand you are very busy people, and if you were not able to watch that recording, I am going to review some of the NORS basics as well as the new NORS FAQs before we get into taking live questions, so that way you didn't miss anything. We are very grateful to have Beverly Laubert, the National Ombudsman Program Coordinator with the Administration for Community Living, otherwise known as ACL, here with us today to listen in and help me respond to your questions. Next slide. So with that, I want to review some basics with you. Next slide. As you likely know from your initial certification training, NORS was first implemented in federal fiscal year 1995 to fulfill requirements in the Older Americans Act, to collect and analyze complaint data and create a system for ombudsman programs to submit their data to the federal government. NORS data collection helps ACL understand and report on ombudsman program operations, the experiences of long-term care facility residents, as well as any changes in long-term services and support. Additionally, of course, NORS brings consistency in data collection and reporting for ombudsman programs. Next slide. In order to help with data consistency, NORC has a 4-part NORS training series available for initial as well as ongoing training for program representatives. The training materials cover basic principles, complaint coding, and reporting other program activities. Each part of the 4-part series includes a basic principles document, a quiz answers, and new PowerPoints, which I'll talk about later in the presentation. Next slide. Thank you. The NORS training materials we develop are based on the NORS tables from ACL. There are 3 NORS tables that define the NORS codes and provide examples and reporting tips. Table 1 provides case and complaint codes, values, and definitions. Table 2 has complaint codes and definitions, and Table 3 has state program information. As a program representative, you will spend most of your time looking at tables 1 and 2. The majority of Table 3 is actually used with State Ombudsman annual reporting for the NORS report to ACL. But there are all of our training materials in Part 4. You will see several codes from Table 3 that do apply to your work. Next slide. So I wanted to review some key updates in those ACL NORS tables. The original tables were updated effective October 1st, 2021, and therefore our training materials were updated as well. So when you visit our website, you'll see a note next to it saying that it was either updated or new with the date that it was updated. So please check back on our website to make sure you're using the current materials. So most of the updates to these tables were minor clarifications, even just some typos and whatnot. But the key updates that I wanted to share with you today is that disposition code 02, the red text was changed. So all the red text on this slide is the new text. And it was changed from withdrawn or no action needed by the resident to no action needed or withdrawn by the resident representative, or complainant. A new complaint code was also added, a complaint code F13 for infection control. For those of you that have been with the program for a while, you knew that NORS was revised a few years ago, and we had over 120 complaints that were condensed into 59 complaints. And infection control was a complaint code that was dropped because it was not used a lot for years. And then COVID happened, of course, after those changes. And so now there is now an infection control code, and there are a total of 60 complaint codes. So infection control, the definition is insufficient measures to prevent or control infection. And there are examples and reporting tips for that code as well. And then lastly, for complaint code J01, administrative oversight, the red text was added to the examples and reporting tips, which states that this code includes problems with the facility planning and implementing an all hazards approach to disaster preparedness and response. So I do want to mention that these changes, as well as the FAQs that I'll talk about in a minute, these were in response to the work that you do and the feedback that you provided to ACL and to your member associations, whether you are part of NASOP, the Association for State Ombudsmen, or NALCO, the Association for Local Ombudsmen. So again, thank you for helping us make NORS better. Thanks to your input about your work. Next slide. So about those FAQs. We create these FAQs in response to questions directly from the network. In fact, we created 2 more FAQs based on questions we received during the TA talk in September. Since we are in a new phase of the COVID-19 pandemic, we also archived NORS FAQs related to reporting activities during COVID-19 that are no longer applicable. However, some of the COVID-19 specific FAQs were still applicable with some minor edits. So those were edited and added to our main NORS FAQ page. I want to highlight the new FAQs, and then as we work through them, I want to hear how you would respond to some of these as well. So this first FAQ is one of the 2 that we created after the TA talk in September. How do I document when I provide training about residents' rights or another topic to a group of residents in a nursing facility that is not during an official resident council meeting? So you can drop in the chat or you can raise your hand and speak. How would you document providing that training? And I do want to mention, as you're dropping this into the chat, that this particular example, we just put nursing facility because that is what the attendee asked us, but of course it's applicable in a residential care community as well. It would just be, you would note the specific setting. So any feedback on how you would code this? And if not, that is okay. That's why we're here today. So work with the resident council. Okay, thank you for dropping that in. Participation in a resident council meeting. Thanks, Jenny. And thanks, Jamal. So yes, I'm going to go ahead and if you could go to the next slide, Libby. Thank you. You would document this training as participation in a resident council, and obviously, like I said, specifically the nursing facility. So that's code S64. This question came up during the TA talk, and I do know that some programs have struggled with this because it wasn't an actual official resident council meeting. And so we just clarified that not all residents obviously participate in resident council meetings. However, all residents are automatically considered part of a resident council or a resident group since they simply reside in that facility. So it made the most sense to us to document it as participation in the resident council meeting. In the description of that, you may notice that it says total instances of attendance, including meeting with council leadership and training of resident councils. So that felt like a good fit. Next slide. Okay, so the other question that we created an FAQ for is, if I go to a facility to visit a resident in response to a complaint I received, but after speaking with the resident does not want my assistance with the complaint. So do I document that visit as a complaint-related visit? Any thoughts on this one? Thank you for dropping that in. A few yeses. Lots of yeses. All right, so it seems pretty consistent that there are yeses. So thank you. Next slide. Thanks, Libby. So first, you would select complaint disposition code 02, no action needed or withdrawn by the resident, specific for that complaint. And then you would document the visit according to what you did during the visit. So for example, if during that visit, all you did was deal with that complaint, or at least try to, and then it was withdrawn, then yes, that would be a complaint-related visit if that's all you did during the visit. However, even though the original reason for visiting the facility was to follow up on a complaint, if you conduct activities that constitute a routine access visit, so you visit with multiple residents, you share information about the Ombudsman program, you walk around the facility and observe activities and things that are going on, then you would document it as a routine visit. So just try to focus whenever you're thinking about how to document your visits on what you did during that visit. So thank you very much. Next slide. Does speaking with a survey agency representative about a specific complaint I'm investigating count as facility survey participation? Thank you. Seeing a couple no's so far. Great. Another no. One yes. Good. Just to mix it up. Thank you. Okay. So I'm seeing a couple yeses so far and mostly no's. So next slide, and we'll get to the answer. So the answer is no, at least with how this question was phrased. The definition of facility survey participation is the total number of instances of survey activity by representatives of the office. So discussing a specific complaint, of course, after receiving consent, is part of the complaint investigation and/or resolution process. So that conversation and anything that came of it would be documented in the case record and not documented as a separate activity, as a survey participation activity. So just to go a step further, if a surveyor calls you and says, hey, we're about to go out and do our annual survey, what have you seen in this facility the last few months? And you give them information, general information about some complaint trends, some concerns you have, then that would count as facility survey participation. Same thing as if the survey calls you and they are going out on a complaint investigation and they ask you for information if you've heard anything about this complaint or you have any feedback or observations to share related to their complaint investigation. Again, that would be facility survey participation because that wasn't part of your complaint investigation. I hope that is clear. Next slide. May I count volunteers participating in initial certification training as other volunteers for our program? What are your thoughts on that one? Okay, see a little bit of back and forth. Yes, no, alternating a little bit. Comment from Meredith, thank you. They are not certified yet, so they're not technically volunteers. Thank you. Another no. Okay, great. We can go to the next slide. So in short, the answer is no. The volunteers, as was stated by Meredith, they are participating in the initial certification training. They are training to be a representative of the office. So tasks during that training are related to their role as a trainee, not serving as an other volunteer. However, you can count a volunteer once the individual completes certification training and is designated to serve in the capacity as a representative of the office. So, thank you very much. Next slide. This is a long one. How do I count information and assistance, INA, if I meet with facility staff and a resident at the same time to provide information? For example, I recently provided information about resident council leadership to a resident and nursing facility staff member at the same time. If one activity meets the definition of information and assistance to nursing facility staff, and the other is INA to an individual, should I document this as two instances of INA? What do you think about this one? So I see some yeses. And Jamel, information and assistance to the first individual asking. Thank you. Another no and a yes. Document it as one, depending on who asked first. Okay. Great. And another yes. All right. So a little bit of variation with that response. Let's go to the next slide for the answer. So if you have an INA conversation with both a resident and a nursing facility staff member at the same time, record the conversation as one INA activity with whichever person, resident or staff, requested the INA. If you have INA conversations separately, even if it's about the same topic, one with a resident and one with a nursing facility staff person, then you would record the activities as one INA with the resident and one INA for nursing facility staff, since those were two separate instances of INA, even though they were about the same topic. Thank you. Hope that clarifies some things. If residents or family councils hold their meetings virtually and invite me to attend and listen to their concerns, share information, and respond to questions, how do I document my participation? And as you can imagine, this happened a lot during the early days of the pandemic. But we're still seeing a lot of virtual meetings, even though we're in a different place in the pandemic now. So I think it's still applicable. What do y'all think about this one? Participation in resident council, family council, great. Document as participation, include that you attended. Oh, and Christine, thank you. She said you can select that this happened virtually by phone or in person. So sounds like your database allows you to be that specific. So that's great. Participation in a council. All right, next slide. So yes, it looks like y'all are all consistent and get this one. Yes, your participation, even if it's virtually, would count as participation in a resident or family council. So just count each meeting as one instance. Similarly, if you meet with council leadership or provide training, document those activities in the appropriate category of resident or family council participation. Excellent. Thank you. Next slide. All right, so those were the most recent NORS frequently asked questions that we uploaded to the website. And I'll show you a slide of where those are here in our resource slides. Next slide. This is a screenshot of one of the slide decks for part 1. And as I said earlier, we created these training PowerPoints. It's a simple slide deck that just follows the training, one for each part of the 4-part training. I will note though, specifically the complaint coding quiz and one other quiz are very, very long. And so we did not include every question and answer from the quiz in the slide deck, because then it would have been hundreds of slides long. We selected a few. So just be aware of that if you use these in your training, and we hope that you do, because they're already created for you. You can add content, make it state specific, even add information about your specific database, et cetera, and forms. But we hope you find these useful, and they're on our website now, and you can download them and adapt them for your use. Next slide, thank you. This is our NORS landing page. I included a link as well. You can find all of our NORS information on this page. So if you're looking for anything, go here first. It has all of our training materials, a link to the ACL NORS tables, frequently asked questions, all of our webinar recordings, NORS data, and more. So please use that web page. Next slide. And since we've spent a lot of time today reviewing the NORS FAQs, I wanted to make sure you had that direct link as well. And the web page that Katie designed for this is, I think, fantastic. So thank you, Katie. But what's really cool about it is you can click on the bullets with the title and jump directly to the FAQ about that issue. And it has the question. You click on the question and you can see the answer. And then she also compiled all the FAQs on a PDF document, which is linked in that description. So you can use the PDF in your training and print that out and share it with your trainings as well. Next slide. So if you walk away, I want you to walk away from this training with some new knowledge about NORS, but if there's one thing in particular, I want you to remember this, that you have a lot of support. We talk a lot about NORS consistency and trying to make sure that your documentation is consistent. However, despite all the training, all the materials, there are still some gray areas and that need clarification. So review all the resources we have available and talk to your staff, and of course, talk to us as well. So I would say first, if you have a question, review the NORS training materials because there may be a quiz example that addresses your question. Review the NORS FAQs, because I guarantee if you had that question, I bet that somebody else had that question as well. Refer to your state program policies and procedures. As you may or may not know, states use a variety of different databases. And so some of the questions you hear today may sound confusing because it's not something you use in your state. So we are focusing primarily on what needs to be reported in NORS, not so much specific databases. So refer to your program policies and procedures, ask your supervisor, and then if that supervisor needs help or maybe you don't have one, you go directly to your state ombudsman. And then of course you can ask us as well. So please reach out to us. There's our email address as well, and I'll share additional contact information before we close out today. So with that, next slide, I want to get to what are your burning frequently asked questions? What did we not address today or in the TA talk in September? And how can we help you with that? Because as you've seen from this presentation, we really do use your real world experience in the field to create our training materials and our FAQs. So we want to know what those stumbling blocks are. So I'm going to mute myself, and then I'm going to drop a link in the chat. Thank you, Bev, for dropping the training and FAQ links in there. And please feel free to hit the raise hand icon and raise your hand if you have a question, or you can put your question in the chat. And Bev, while folks are thinking about questions, if there was anything that I missed or something you wanted to highlight from what I just shared, please feel free to do that as well.
Yeah, that was great.
Okay, just dropped the link to today's PowerPoint slides in the chat.
Roommate conflict, who has to leave and what regulation supports that? I mean, there's a question about roommate conflict.
I see that. So that is a great question. I don't think, Anne, that that's a NORS question. That's more of a case-specific question and how to work a case. So without more information about that specific case, that's hard to answer, except for I will say that there's not a regulation that supports moving one resident over another resident out. That's something that just has to be sorted. I think originally, or oftentimes, I shouldn't say originally, oftentimes when ombudsmen are pulled into these kind of cases, it really is whoever complains first. So whoever has the issue with the other resident is often the one that needs to be accommodated and moved. Instead of me, so if Bev's my roommate and I complain about Bev, it wouldn't be fair to move Bev out. So
but it could be likely.
Say that. I could say that at least without knowing the rest of the case. So yes, and Christine, yeah, that in her area, it's the person who requests to have a new roommate. So yeah, asked to move and accommodate that. So I hope that helps, Anne. And if there are cases like this that you want to review, you can also reach out to NORC for that. But of course, I encourage you to talk to your supervisor or state ombudsman first. But we are available to discuss cases as well and some advocacy strategies. So Meredith has a question. A certified ombudsman specialist is full-time, but doesn't do any ombudsman duties. They manage fiscal related and HR related duties for the program. Will we report them in our regional program staffing count because they are certified ombudsmen? So I have an opinion, but I'm going to let Bev respond to that first, since this is where the reports go. So Bev, I'm going to let you go first.
Yes, I actually probably know what the situation is. And based on what I know about what I think the situation is, I would say yes. because if I am correct, this is an independently operating ombudsman program, and the person also occasionally does some intake for the program and is necessary to the operation of the ombudsman program. So if I'm correct about that situation, I would say yes. Oh, but no longer doing intake. That changes it for me a little bit, I think. Amity, what were your thoughts about it?
So I think that's a great question, and it does make it throw it for a loop about intake. So my one caveat, I would say, though, depending on what the HR related duties are. So are we talking about HR as in program management of other representatives of the program? And if that's the case, then they are training and supporting other representatives. And so I would see that as work in the ombudsman program. So that, to me, that's like supervising volunteers. You're providing support and training. So,
but typical HR functions like hiring and evaluating personnel and that sort of thing, I'm not sure is specific ombudsman activity. So again, Meredith, so many of these answers are, it depends on the facts of the situation, but hopefully that gives you enough information to kind of use some criteria for you to use to decide.
Yep. And if not, you know how to reach us and we can dig a little deeper offline. But good question. And I think that is somewhat similar, not the same at all, but somewhat. I immediately thought of volunteer ombudsmen that are trained, certified to resolve complaints. They've had all the same training that anyone needs to have to be designated as a volunteer, but maybe they don't deal with a lot of complaints, or maybe they only deal with complaints regarding quality of life, resident rights, what we would deem kind of simpler complaints, but they would still be a designated representative of the program and counted in that count. So I think there is some wiggle.
Yeah. And I will say that if the individual has access to resident information, then they do need to be certified. So if they have access to your database so they can see cases and that sort of thing, then they would need to be certified.
Absolutely. So another question I received, which is a really good one, and we have information in the training materials. I just can't remember which one it is, part 3 or 4, but asking about when should instances be changed to more than one? So in this example, in regards to working with a nursing facility survey team, if we have several contacts with that team during one survey, do we change the instances to every time we have contact? And yes, good question. Yes, you do. So that means if the survey team hopefully calls you before they enter, because that's what they're supposed to do, is get information from you, that counts as one instance of participation in the survey. Then if you go on site and you're there during a resident group meeting, then that would be another instance. And then if you're there for the exit, that would be another one, because you are sharing likely different information at every step of the way, and then you're also receiving information every step of the way. So yes, you count every instance of participation. So good question, and that example is actually in our training materials as well. So if you need to use that in training, review those materials.
And I'll add that if you have been an ombudsman for more than a few years, that is a change. So just so you know that that is a change. It used to be just counting per survey, but every instance.
Thanks, Deb. That's helpful for sure. A question we received during the registration process was when when does an information and assistance, or when an INA becomes a case, what happens to the previous documentation under activities? So again, this kind of goes back a little bit to some database issues depending on your program that you use. So I don't want to get into that, like what happens to the activities that were already documented. But I do want to say that an INA doesn't really become a case. So there are situations where someone calls you, Ms. Smith calls you with a question about resident rights. You respond to that by providing information that would count and be documented, hopefully very quickly after you provide that information, as an INA. But then Ms. Smith calls you back with a complaint. Then that would be a complaint separate from the INA. So they don't really run together, and they're not documented together as an evolution from an INA to a complaint. Those are two separate activities, even though it may be the same person and even though it could be the same general topic. So I hope that provides some clarification to whoever entered that question during registration. Okay, I think I've been through, let me double check the chat, all the questions in chat so far. So anyone on the line, feel free. Oh, another message, great. So our program has been focused on attending senior fairs, volunteer recruitment, sharing ombudsman program, and sometimes INA. What is the best entry? Communication, community education, volunteer recruitment, etc. Good question. So while I'm gonna pull up my North page. So just one second. And Bev, if you have an immediate response.
Well, I just want to ask a clarifying question. So are you saying that you attend a senior fair, and during that activity, you might touch on a variety of topics? You might be recruiting, somebody might walk up and you might talk to them about volunteering. Someone else might walk up and say, what's Medicaid? And you provide them information about Medicaid. Is that, so it's one event, but you're covering multiple things? Is that what I understand? Okay.
Thank you. Yes, I was wondering the same thing. So, and the reason I wanted to refer back to the ACL table actually was to look at the definition, because I don't have everything memorized specifically for community education. So community education says the total number of instances of community education outreach sessions by the Ombudsman program. You can use for attendance of health fairs, community events, general presentations. If education's web-based, Ombudsman program must have a way to count the number of individuals, etc. So, Bev, this is kind of my thinking. Let me know what you think, and I hopefully don't confuse it even more. But
which table are you looking at, Amity?
It is table 3, code S68, so page 33. To me, when you, community education and the examples and reporting tips refers to a presentation of some sort. So attending a health fair and isn't giving a presentation at the health fair. You are meeting with individuals that come up to your table. And to me, those seem more like individual instances of INA that you're providing as those individuals come up. Unless you're also doing, you know, sometimes in an exhibit hall, they may ask the exhibits to talk for 5 minutes in front of the whole group that's there. Then that would be more of a presentation. So that's, what do you think, Bev?
Yes, I agree.
Because could you count
I mean,
the health fair? Oh, sorry, go ahead.
Yeah, so community education makes sense if you, because you need to have a way to count the number of individuals, then you may want to kind of keep track of, you talk to 5 people about volunteering, 10 people about, whatever, and then kind of decide to code it that way. But yeah, that what you said, I think makes sense, Amity.
Okay. Yeah, because I'm kind of struggling a little bit with the examples and reporting tips used for attendance. And like you said, you have to have a count of the number of individuals who completed the session in order to report it in NORS. So speaking more of education as in an actual training. So we may have to create an FAQ on this question, because that's a good one, because I almost see it as going to an event as community education, and then you also count the number of individuals a day, because you're not providing a training.
Yeah. So you're thinking maybe information and assistance more generally.
Mm-hmm. And maybe it's not a good fit to have health fairs under community education going forward.
Mm-hmm. Yeah, maybe we can look at that.
Yeah, and like Suzanne said, yeah, I thought the count was only required for virtual or web-based community education. Yes. Online, on demand. True. Yeah, it does say web-based or online. I guess it's throwing me off because it says used for attendance at health fairs, community events, and general presentations. So if you count it as community education because you attended the health fair, then you also wouldn't count. So here's the question, Bev, too. So if in the reporting tips it says used for attendance at health fairs, could you count it as community education because you went to that health fair, and then also count the individual INAs that you provide while you're at the health fair?
Well, possibly. Now I'm going to give you a scenario that I'm familiar with from my ombudsman experience, in that there might be somebody in the office who kind of coordinates the event, works with the organizer. Although I guess that's more about training. Never mind. Yeah, I think you could. I don't like the idea of double counting, or even implying that we want people to double count or double document, because we don't want to create that added burden. But yeah, I do think we need to clarify that. So why don't we work on an FAQ about it? I'm comfortable with calling it information and assistance.
Okay, so just to make sure, okay, so someone said we do keep track of the number of folks we speak to utilizing a survey. We also use a volunteer sign-up sheet. So we don't count, Jamal, just to answer the question about volunteer recruitment.
Yeah,
NORS doesn't track volunteer recruitment activities, so that's an easy answer that we have for you right now. But so just so I'm clear, Bev, and the folks listening are clear, for this, since we don't have an FAQ on it yet, and the definition does say for community education, attending health fairs, should we just count it as community education for now, period? And then we'll dig into it deeper if we need to make adjustments. Okay.
Yeah, that's fine. And I'll make another comment for people who have been around for a few years, and I'm not sure about Jamal or not, but at one point we did in NORS ask for, or you could count volunteer development activities, such as what is being mentioned here as technical assistance, but we don't have that in NORS any longer. So just so you know, that if you have been in the program for a while and are used to counting that, that's not something that gets reported now. You might still count it in your state, but it's not reported here.
Thank you. And I just dropped in the language from table 3, so everyone can see it in the chat. All right, good questions. This is exactly why we do these things, and I love these conversations because there's always something new that comes up.
Hi there, this is Devorah, PSA 33. Can I ask a question?
Yep.
Of course, go.
So mine is on self-neglect. And when we're entering a case on self-neglect, this is actually very common. Residents not wanting to take or refusing to take a shower, refusing medication, or choosing to leave against medical advice. Under the SOC 341s, they're listed as a victim, but they're also listed as a suspected abuser because they're self-neglecting. But whenever you're coding it, when you code A through M, the assumption is that that coding is against the facility. So when it's a self-neglect, how do you appropriately code it as a complaint? And the second part of it is whenever you are listing the resident as a suspected abuser in the case, because that's how it's looked at, it doesn't give you an option that the resident could be a suspected abuser of their own. It only gives you the option of others and then the word other, which that's how it's being labeled. So how can this be captured better to distinguish how much self-neglect is being reported and how many of those cases we're assisting?
And I'm sorry, what did you say your name was at the beginning? I missed it.
Devorah, PSA 33.
Hi. Great, thank you. Excellent question. So I'm pulling up table 2, which is all the complaint codes, and I'm double checking all the abuse codes because I wanted to make sure before I said anything that self-neglect isn't
not
included, in a definition or example.
Right.
And so, yeah, I see what you're saying about identifying the alleged perpetrator. So, but I do want to be clear on the part about the facility, because I think you said that you felt like when you code it, it would be against like a complaint against the facility. Is that correct?
Well, it's about being told that when you code A through M, to be mindful that those are not against a family or an agency. It's these codes are meant to be against the facility. So then your only options are the last two, I believe is like system others or the last two. And when you look at the last two, none of those are identifying or are close to self-neglect. And none of the A through M also, I mean, the only one that I can see is other preferences and rights. Yes, residents have a right to self-neglect, but there's a lot of categories in there. So that I think is really missing, and it's hard to not only capture in the data, but it's hard to be consistent in submitting it as a complaint.
Yeah, no, that's a good point. And I see your point about how we broke apart the complaint code saying that some are quote unquote against the facility, but it's really not, especially the abuse cases, since you're identifying a perpetrator that's involved in that case, it's not necessarily against the facility. We just want to be really clear that people are mindful when a complaint didn't have anything to do with a facility and it was outside provider, which categories those were. So I hear you on that. I don't have a good answer for this, Bev.
I don't think that we really intended for Ombudsman to count self-neglect. I mean, we hear that a lot in the adult protective service field, but I believe that what you're describing is a resident exercising their right to refuse treatment. So I think part of the question, and this may be more of a, as Amity was talking about earlier, this might be more of a case example to discuss and then figure out the reporting implications. But I think, I'd want to know who's the complainant. who is complaining about the resident, because that's kind of how it's being presented. And so we want to think about being resident directed and how would we code that and handle that as a case as from a resident directed perspective.
Yeah, 9 times out of 10, these are SOC 341 reports. And when Odin was entered, that was taken. In the previous 2 databases that were used over the years, self-neglect was in the coding, but that one was taken away. And like I said, 9 times out of 10, it's the facility reporting this under an SOC.
So
I think some of the terminology you're using might be state terminology that Amity and I aren't familiar with in NORS.
Is that an incident report from a facility, the SOC report?
Yes, these are
okay.
SOCs. These are reported, residents leaving against, I mean, these are all different scenarios, but it's typically refusal of medication, refusal of showers, or again, leaving against medical advice. And these do end up going into cases because then we determine it's ends up being something else, or it might be exercising their rights. So it can go a lot of different ways, but capturing it and making sure that the data is there to show how many reports or how much self-neglect, because that's a form of abuse. I mean, it's even on the SOC. I don't think it's really well captured, or I don't know how to capture it on a basis where it's effective.
So I want to focus more on, and again, like Bev said, we can talk about this more offline too, but I want to focus more on what the Ombudsman data says, not so much what the facility incident report says, because those are 2 different data buckets per se.
Right, yeah.
Because what the facility is determining as self-neglect from the resident perspective and the Ombudsman resident directed perspective, we may see it as this resident has dementia and is fearful of showers, and we need to, that's the root cause. It's not that they don't want to take a shower, they want to be clean, but they haven't found a way that is resident focused and safe for the resident to do so. And that's what you'll figure out as you're investigating it as an ombudsman. And so that would be coded as, issue with bathing or care plan not being followed or whatever it ends up being. So instead of focusing on how the data reflects self-neglect, I want to take that incident report as just information from the facility. Then you follow up with the resident and you're following the resident's lead on what that complaint becomes. Does that make sense?
It does, but it can go both ways. And it would be helpful to capture both ways when a resident is self-neglecting, because that does happen, or when it is being reported, but during the investigation, that wasn't really what was happening. So if both can be, cleared up, I think that would be helpful.
So I think you brought up a really great training point that we haven't focused on. So I'm going to dig into this a little bit more, and I'm going to follow up with you if that's okay, and we can talk more about this case and specific examples in your state as well. Because if you're seeing it, I assume others are, and depending, it may just be state specific. So what state are you in?
California.
Are you in California? Yeah, okay. Yeah, because that's also a big difference. Not all ombudsman programs receive and respond to incident reports. So that also impacts data as well, and skewing data too. So, all right. Thank you so much. I will follow up with you, Devora.
You're welcome. Thank you.
All right. And Christine asked, will you send us the follow-up? Yeah, we'll figure out some way to respond. I'm not sure what that will look like yet, Christine, if it'll be an FAQ, if it will be a brief training tidbit, I'm not really sure, but we'll figure out some way to share that. Good question. Okay, so with that, we have 5 minutes left. I don't know how that went so fast. This was a really great conversation. And we also have, for those of you that maybe haven't listened to these calls before, We started this grant year in July, these new monthly open office hour, they're virtual office hours. We have focused on volunteer management for the last few months, but we're going to change the topic for this month, and we're just not sure what it is yet. But questions like this about self-neglect, that actually would be a great conversation to have, or any of these conflict of interest, or more of the meatier things and issues that you have, email us, and we can start adding that to our list for these calls and conversations, because they're supposed to be peer-to-peer support as we all figure this out together. So next slide, Libby, please. As I said, feel free to reach out to us if we made things even more confusing. Not Bev, me, I will own that. If I made things more confusing today than it was before, let me know. Maria Green, you may be familiar with her. She is a subject matter expert that works as a consultant with us as well, and you can reach out to her too. She's just returning from a fantastic vacation. So that is her email address. Next slide. And if you are not on our mailing list and you heard about this training from somebody else in your office or program, please join our mailing list. You will receive our quarterly e-newsletter, information about training opportunities, and then all the new resources we create. So that is the sign-up list. Next slide. And then, of course, here's our contact page. We are on social media, and we have an app, if you don't have that already, that was created to help you all in the field access information quickly. So please check us out and connect with us in all of these ways. Next slide. I put the, oh, I don't have a next slide. That was the last one. I put the link to our evaluation in the chat, so please complete that. And I want to give a big thank you to Bev for joining us today and for her guidance and support, not just to NORC, but of course to all the Ombudsman programs. Thank you, Libby, for always masterfully handling all the back-end webinar logistics. I really appreciate it. Couldn't do it without you. And thank you all again for joining us today, for your excellent questions. I love that you make us think and all the important work that you do. So again, please complete the evaluation using the link. We really do use your feedback in how we shape our training and resources. Okay, so thank you very much. That's all that we have for you today. Great discussion, and please have a good rest of your day and week, and let us know what you need. Take care.
Bye, everyone.
Bye.